Osce tip of the day: never skip the patient's identity. Confirming the ID of the patient is very essential in Osce. The beginning of your presentation, after you introduce yourself in a hospital setting, you need to confirm the identity of the patient, making sure you are with the right patient. In the hospital setting, you confirm the identity by cross-checking with your document, the wristband, and then verbalization from your patient. So you ask your patient, can you please confirm your name, date of birth, whilst I cross-check with my documents and your wristband. That is the ID check that you do in the beginning of your presentation. And also, if you go and pick your articles and come back to your patient, coming back to your patient means you also need to validate the identity of the patient. There is something called the second ID check. You can either verbalize it to the patient to confirm, because you've already noticed that it's the right patient. You can verbalize it for the patient to confirm, or you can still ask again for the patient to tell you. Let's assume I come back from picking my articles. As soon as I get to my patient, I'm going to say, Araba, can you please confirm your name, date of birth, whilst I cross-check with my documents and your wristband again, for you to identify that you have the right patient. You can do that. Again, when you walk into the scene to continue the step 2, you can say, did you say your name is Araba Lawson, date of birth is 10th March 1945? Yes. Then the patient will respond. And then you go ahead to say, I can confirm I'm still with the right patient. Patient identity is very important in Osce. Make sure not to forget it. You can also confirm the identity of the patient by mentioning their allergies and the reaction they get. Hi, I'm back. Did you say you are allergic to penicillin and peanuts and you get anaphylaxis as your reaction? That is also a way of checking the patient's identity. Identification in the hospital setting, you need to confirm with the wristband as well as your document and the verbalization from your patient. But when it comes to community setting, the identity of your patient can be confirmed by the patient mentioning the name, the first line of address, and their date of birth. When it comes to community setting scenario, all you are going to need is these 3 things: the first line of address, their name, and date of birth. In addition, when you come back to do the step 2, when you go and pick your articles and go back to the patient, you can still find out the second ID check by verbalizing their name, date of birth, and first line of address, along with their allergies, or however possible that you can. Make sure you don't miss the identification of your patient in Osce. Osce is not difficult. Make sure to go and write it as soon as possible. Note these tips and let's pass together. Follow me for more, and thank you.